Welcome, everybody, to the OPT Network. This morning, we're talking about a very important and even a vital subject that might save your life or the life of someone you love and care about. We're talking about stroke and stroke awareness. Did you realize that every 40 seconds, someone somewhere is having a stroke? Well, our partners and friends at Christus St. Cabrini Hospital are here to educate us and let us know the warning signs of strokes. And here to talk about that is Dennis Flynn. He's a Sepsis and Stroke Coordinator at Christus Cabrini Hospital, and he's been a nurse for well over a decade. Dennis, good morning and welcome.
Good morning. Thank you for having me.
It's a subject that we really don't like to talk about because we never really think that it'll happen to us. And sometimes strokes happen very innocently.
Yes.
Or seemingly.
Yes.
Let's talk about a stroke, first of all, and what it is.
Okay. A stroke is when blood is prevented from getting to a part of the brain. All our cells need oxygen to live, and they get oxygen by blood. Blood carries oxygen to our body. And if there's a clot in a vessel in our brain, or if one of our vessels in our brain bursts, then that blood can't get to where it's supposed to go. And without blood, that part of the brain starts to die because it's not getting oxygen. And when that part of the brain starts to die, that's a stroke.
And I think that anytime someone has a stroke, especially someone close to me, I always ask this question: were there warning signs? Are there usually warning signs?
The symptoms of a stroke can come on slowly, but they're usually pretty definite. You usually know pretty quickly that something's wrong. It's not something that begins over a period of days or weeks or anything like that. Now, some people can have a small stroke and develop symptoms and not seek care because the symptoms are very, very insignificant to them. And lo and behold, they've had a stroke and didn't even realize it. But most significant strokes hit pretty hard and pretty quick.
And so when you talk about those insignificant or seemingly insignificant strokes where you have some symptoms, but yet they pass, and so you move on. And so let's talk about some of the factors that contribute to strokes.
Okay. Diet is a big factor for stroke, especially here in the South. We love our food. It's delicious, but it's not kind to us when we overindulge. Diet itself does not have a direct impact on stroke, but our diet influences our blood pressure, it influences our cholesterol, influences diabetes. And hypertension, high blood pressure, diabetes, and high cholesterol are three very significant risk factors for stroke.
So let's talk about that cholesterol, because it's such a tricky subject. You know, 1 minute the numbers, are one thing for cholesterol, then they go a little bit lower. How concerned do we need to be about our cholesterol numbers?
You need to have your cholesterol checked regularly, and your provider will let you know where your levels are and how far away they are from where he or she would like them to be. But if you eat a healthy diet and keep that in mind with your blood pressure and diabetes, then your cholesterol will kind of automatically fall into place to where it should be. Now, there are some patients, for genetic factors or other reasons, that require medications for their cholesterol. And your doctor would best be able to decide if you're someone who could benefit from an actual lipid-lowering medication.
And so we were saying that strokes, some of them just come on suddenly without you kind of knowing that you're having a stroke. So what are some of the things that people, especially with high blood pressure, diabetes, and maybe cholesterol issues, what are some of the symptoms that they might experience if they were having a stroke?
Okay. We use the term BFAST, B-E-F-A-S-T. It used to be FAST, F-A-S-T.
I know. When did they add the B?
A couple of years ago, the B and the E
changed. The B and the E.
The B and the E were added. And B stands for balance. If you experience a sudden change in balance, a sudden inability to walk, you get up to walk and all of a sudden you're leaning to one side, and you feel like you've got a lot of weight on one side of your body, and you really can't walk straight, and your balance is just off for no reason. That could be a stroke. The E is for eyes, vision. If you have a sudden change in your vision, and everyone's vision changes over time.
Mm-hmm.
But when we talk about these symptoms, we mean sudden.
Mm-hmm.
Like one moment you're one way, and the next moment you're a different way.
Mm-hmm.
So all these symptoms, that's what we're talking about.
Mm-hmm.
Sudden, unexplained changes.
Mm-hmm.
So if
So
you're,
is it like you lose your vision for?
well, you could lose your vision. You could lose your vision in one eye. One eye could get blurry. You could, instead of having your normal vision, all of a sudden you have no peripheral vision on one
Mm-hmm.
side or the other. Um, Maybe your eyeball stops moving like it should. You can
Mm-hmm.
normally move your eye all,
Mm-hmm.
up and down and all the way around.
Mm-hmm. Mm-hmm.
And if all of a sudden you can no longer move your eyes to one side, okay, that could be something's causing that, and that could be a stroke.
Mm-hmm.
The F is for face,
Mm-hmm.
and a facial droop or tingling or numbness on one side of the face. And many times when a stroke patient is experiencing facial droop, they are even unaware of it because they don't
Okay.
see their own face,
Mm-hmm. Mm-hmm.
And it's a family member or a friend who's talking to them, and that's the person who usually notices, hey, what's wrong with your face?
Mm-hmm. Mm-hmm.
There's it's not moving,
Mm-hmm.
And so one of the first things they will ask a patient to do is to smile for us.
Mm-hmm.
And when they smile, they'll only have half of a smile. One side of their face won't
Won't
smile.
move.
Or we'll tell them to close their eyes real tight, and only one eye will close tight, and the other will kind of lag behind.
Mm-hmm.
So one side or the other facial droop
Mm-hmm.
or numbness or tingling.
Let's talk about that tingling. What's
Okay.
going on with the tingling?
It's just a different part of your brain that sends and receives those sensations that's just not performing correctly. It could, like I said, it could be a paralysis where your face doesn't move. It could feel numb, or it could feel the tingle. Like if you go to sleep on your hand
Mm-hmm.
or your foot the wrong way, and you wake up and it's tingling. It feels like those little needles in there. Okay, that's the tingling.
So what
And-
should people do if they start having those symptoms in their face? Because most people are like, well, I'm going to just see if it's going to pass.
Exactly. And if you wake up, or if you just all of a sudden develop a tingling or numbness in your face, and if it goes away within a few minutes, then you could probably sit and wait and see if this happens again. Okay, but if you have these types of symptoms and they don't disappear within a few moments, you need to get some help. You need to seek medical care. Stroke symptoms is not something that you want to wait around and see if it resolves.
Mm-hmm.
If you have a toothache, you may want to wait around before you go to the dentist. If you have a sprained ankle or something, or a pulled muscle, you may want to wait around to see if it gets better. But stroke symptoms is not something you want to wait around and see if it gets better.
And so every 40 seconds, somebody somewhere
That's
is
the
experiencing a
average.
stroke?
That's the average, yes.
Wow.
Yes.
And so let's talk about, okay, we've got to the symptom in the face, and then the arms.
The A and B fast stands for arms and legs. And similar to face, you're looking for numbness or tingling or weakness in an arm or a leg. It's usually, it may be an arm, it may be an arm and a leg, and it's usually just on one side of the body. Sometimes people come in and the complaint will be, both my legs just feel so weak. And that's usually not indicative of a neurological problem, it's something else. But if one leg or one arm all of a sudden is weak or numb or tingling, and pretty profound weakness where it inhibits their ability to walk or to pick something up, okay, that could be a stroke.
Okay, and what about S?
S is for speech. Speech is probably the most obvious, overt symptom of a stroke, and I think that what people would kind of say your textbook presentation of a stroke would be slurred speech, and the person is speaking and they may or may not know their speech is slurred. Many times they can't even detect it. It's a friend or family member that detects the slurred speech, and they will go to speak and they'll have some facial numbness or paralysis, or that transmits into the tongue. So when they go to speak, it's kind of like when you go to the dentist and you get that Novocaine shot and you try to speak afterwards, or if you try to try to whistle and your mouth doesn't work correctly,
Right.
it's very, very similar to that. So they'll have that slurred speech, or they'll have the inability to verbalize a word. They'll see something like this cup, and they know it's a cup, and they want to say cup, but their brain cannot send those signals to voice the word cup. And that's one of the signals, one of the assessments we'll do for a suspected stroke patient. We'll hold up an item, and we'll say, "Can you tell me what this is?" And normally someone would say it's a pair of glasses, and this is a cup, and this is a table, and they'll look at it and they'll know what it is, but their brain cannot make the word. And it's extremely frustrating for the patient to do that, because they're afraid. They know something is wrong. Something is really wrong. But that's one of the assessments that we use.
Before we go to T, Dennis, let's take a break here. But when we come back, we're going to give some really pertinent information about if you have stroke symptoms, how you may be able to reverse the stroke process by getting to the hospital quickly. Stay on point. We're back with more right after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about stroke and stroke awareness. Every 40 seconds, statistics say that somebody somewhere is having a stroke. And in the United States alone, about 795,000 people every year, Dennis, have strokes.
Yes.
That's a lot of people.
It's a lot of people.
So before we talk about the types of strokes and what we can do, let's talk about what the importance of T is.
The T in BFAST is probably the most important thing that I can tell you today, or tell the audience, and that's time. Time is critical when it comes to stroke care, because not all strokes are treatable. There are some strokes that are just catastrophic, and there's not a lot we can do for those strokes.
Wow.
But the majority of strokes are treatable if we can get to that patient quickly enough. The majority of strokes are ischemic strokes. There are two types. There's ischemic strokes.
So what does that mean? What does ischemic mean?
Ischemic means there's a clot.
Okay.
There's a clot somewhere in some vessel in the brain. It could be a small clot in a small vessel. It could be a large clot in a larger vessel. And a hemorrhagic stroke is when one of those vessels burst. The vast majority of strokes are ischemic, which is good because they're much more treatable than a hemorrhagic stroke. We have a very powerful clot dissolving medication. And if we can give that medication quickly enough, we can sometimes dissolve that clot.
And keep it from bleeding out through the brain.
Exactly, exactly. That's one of the risk factors. Now, when a patient comes in with an ischemic stroke, and we determine that it is ischemic, they're having a stroke, it's not a bleed, we can give this medication. It's called alteplase. And tissue plasminogen activator. It's a protein that works on dissolving clots. And the medications, the name is alteplase, and it's a manufactured TPA. And this is given IV, and it circulates through the body looking for clots. And if there's a clot,
it circulates through the body looking for clots.
Yeah. We give it IV, and we give a bolus as an IV push, and then we give an infusion over an hour. So it takes a full hour to administer this medication. It's a very, very powerful clot-busting medicine. So the first thing the doctor's got to do before we give this medication is do a complete evaluation of the patient. If the patient has any risk factors for bleeding, we can't give this medication. If the patient is on certain anticoagulants, not every anticoagulant, but certain anticoagulants makes the patient ineligible for the medicine. If the person has had a history of bleeding, sometimes we'll have a patient that's had a history of gastrointestinal bleeding or something, or some other kind of bleeding disorder. And if a patient has that medical history, then they're deemed unsafe to receive this medication. So the first thing we have to do is do a complete evaluation, do a complete check of the person's medications. And if that patient can get to us quickly enough so that
So let's say quickly is relative, right?
Okay.
What does quickly mean?
Okay. The Food and Drug Administration has said that we can safely give this medication within 4.5 hours of stroke onset time.
Okay.
So if you've had this stroke at, let's say your symptoms began at 12 noon, okay, you've got 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, 4:30, okay, you've got that time to get to the hospital, okay. After 4:30, we cannot administer this medication,
Really?
even if you're eligible for it,
Really?
because the Food and Drug Administration has decided that the risk of developing a bleed is greater than the benefit of dissolving that clot.
Oh, wow.
Exactly.
So 4 hours is critical.
Exactly. Exactly. That's why if you have stroke-like symptoms, or if you see your friend or family member and you suspect they may be having a stroke, we don't want to wait the 4 hours. We want to get there as quickly as possible.
Right.
Quickly as possible. Call 911. We want an ambulance there. Their paramedics are trained to do assessments. They're going to do some really, really quick assessments. They're going to get an IV started. They're going to do an EKG. They're going to check blood sugar. Blood sugar is very important simply because low blood sugar symptoms often mimic stroke symptoms. Patients when someone's sugar drops, they can become confused, they can become weak, and someone can look at this person and say, I think this person's having a stroke.
Right.
And it's just blood sugar. So the paramedics are going to check this blood sugar real quick, do all these other tests. They're going to call us and tell us, hey, we have a stroke alert. We're bringing you a suspected stroke patient. So when that happens, we get ready in the emergency department. Our registration clerk gets at the back door. We call our CT department. Everybody's on standby. So as soon as that patient arrives, we get that patient in our computer, and the paramedics don't even take the patient off the stretcher. We roll straight to CT. We get that CAT scan, and we roll straight back to the room. So before the patient even gets into the emergency department, we've already got a CAT scan done on this patient to determine, is this a hemorrhagic stroke or not? And so we know which pathway we're going to go down. We're going to go down the hemorrhagic stroke pathway, or we're going to go down the ischemic stroke pathway, because it's two completely different treatment plans for these
So
patients.
say, and for the sake of this conversation, we now know it's 4 hours. 4 hours is critical. But say that the person, missed that window. We know that they can't get this treatment that kills the clots or finds the clots. So how would it be treated, in the event that you got there later? What would be the protocol?
Okay. When we do the CAT scan, we can tell if that clot is in a small vessel or if it's in a larger vessel. A CTA, CAT scan angiogram, and we'll
So it's definitely going to show
if it's a large
clot.
Yeah, when they do that CT angiogram. And what we can do now, and this is I say recent innovation over the past few years, and recent in terms of medical advancements change every day.
Sure.
And once they start, it sometimes takes years for them to become best practice in mainstream. But not long ago, they started the practice of doing thrombectomies. And when you have a large clot in your brain, they can put a catheter either in your arm or in your groin, like when a patient gets a heart cath.
Sure.
And they're able to push this catheter in up to the brain, grab that clot
To the brain?
and pull that
Oh my
clot
God.
out. Exactly.
Really?
That's a thrombectomy.
Through that catheter?
Exactly. That's a thrombectomy.
Wow.
Now, only certain hospitals do that. And when we have a patient that is eligible for that, we'll transfer that patient to Ochsner Medical Center in New Orleans or LSU Ochsner in Shreveport. They have the equipment and the interventionalists that can perform that procedure.
Wow. And so I know that you personally have experienced stroke. So did it make you more passionate about the way that people are treated and understand stroke?
It did. It did. My father passed away last summer from a catastrophic hemorrhagic stroke.
I'm sorry.
Thank you. My father took care of himself. He was very active. He was 89 years old. And he had just a catastrophic hemorrhagic stroke. And at that age, with that size of a stroke, there's not many options that you can do. And a younger person, or even an older person for that matter, with a small hemorrhagic stroke, they can just take a wait and see approach, and sometimes the brain tissue will reabsorb that blood, and the person may recover with some mild deficits or maybe no deficits at all. If it's a large bleed and the person is a candidate for surgery, they can do surgery. They can do brain surgery and go in there and try to stop that bleed and try to take out some of the blood that's leaked out to relieve the pressure. Because when the blood leaves the vessel and just spills out into the brain tissue, it starts to cause pressure to build up. And that pressure is where your problem comes. You're not getting blood to where it's supposed to go because it's spilling out into the other parts of the brain.
Wow.
And it starts to build up pressure. So when they do brain surgery, they can relieve the pressure and try to stop that bleed. If the person is taking blood thinners, anticoagulants, and they develop a hemorrhagic stroke where they're bleeding out, they come to the ED, we can give medication to reverse those anticoagulants. First of all, we're going to stop the anticoagulants, make sure they don't take any more.
Right.
And sometimes we can give medicine to reverse the effects of those anticoagulants.
Wow. Let's take a break here, but when we come back, we'll talk about how we can prevent strokes. Stay on point. We're back with more right after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about stroke awareness, what we all need to be aware of. 795,000 people, almost 800,000 people every year have strokes. And so this morning, Dennis is here to talk about what we need to know and understand, the acronym Be Fast. But most importantly, how can we prevent a stroke from happening? And so one of the things that we were talking about were all of the things that can happen. But high blood pressure is really, really something that I want to talk about because a lot of people, especially in various different cultures, I know the Black community for sure, we have a propensity for high blood pressure. And I'm one of those people as well. And I have family members who just surrender to the fact that their blood pressure is high. And I'm not talking like a little high. I'm talking like sometimes 190 over, let's talk about blood pressure and how that plays a role in strokes.
Uncontrolled blood pressure is a major risk factor for stroke. When your pressure is that high, it is putting pressure on your vessels 24 hours a day, constantly. So your vessels are having to take a lot of pressure that they weren't designed to take. They compensate to a degree over time, but they can't compensate forever. And if there's a weak spot somewhere on one of those vessels, it can eventually burst.
It's almost like a sleeping volcano.
It's a good way to put it.
Wow. And so how can we know that diet is a factor, but how can we, prevent, is there a way to prevent strokes?
There are some things that you can do, that anyone can do, that will decrease their risk of stroke. The number one risk factor for stroke is smoking.
The number one risk factor is smoking?
Smoking. Tobacco smoke can thicken the blood and narrows the vessels. So it's a perfect combination for causing a clot to happen. So if you smoke, stop smoking. If you don't smoke, don't start.
But the thing of it is high blood pressure and people who smoke, once you get addicted to nicotine, it's so hard to stop smoking.
It's very, very difficult. It's probably one of the hardest things that people can do. There are options out there that doctors have. They have medications that they can give. There's lots of different treatment options. There's hypnosis. There are other issues that other things that people can do to make an attempt. And sometimes it takes a family. Sometimes it takes several people. My own mom smoked for a long time. And one of the things that really got her to recognize the problem was her doctor. And her doctor told her, said, well, if you don't quit for yourself, quit for your children. Quit for your family. Quit for the people that love you. And that made a significant impact on her right there. And that's one of the things that helped her quit smoking. But stopping smoking is the number one thing that you can do, or anyone can do, to decrease their risk of stroke.
Wow. And so for those people that are saying, Dennis, I think that I have, encountered some of these symptoms and they passed and I just moved on because it was kind of like a spell. What do you say to those people?
There's something called a transient ischemic attack. It's abbreviated TIA. And you can have stroke-like symptoms come on any one of the symptoms that we've mentioned, and it'll just quickly resolve within a few seconds or a few minutes, or maybe after 20 or 30 minutes, the symptoms just go away. And it leaves you wondering what just happened to me. I thought I was having a stroke, but now I feel fine. And those are usually diagnosed as a TIA, transient ischemic attack. And I'm not really sure what the mechanism that causes those to happen, but once you've had one, you tend to have another eventually, and they can often be precursors to strokes. So sometimes we'll have patients that we'll get to know very well because they'll have these TIAs and they'll come into the hospital and they'll present with these stroke-like symptoms, and we think they're having a stroke, and it's a TIA. But the thing
Are
is,
they treatable, the TIAs?
they're usually not treatable. What we do is we do a CAT scan and we can get a complete workup on the patient and see if we can find something else that's wrong that may be contributing to this. But the TIA itself is usually not treatable. It's usually a warning sign. It's a precursor to an actual stroke. So someone that's had these TIAs where they've got stroke-like symptoms that just resolved on their own, and if you've had one or if you've had several, don't ignore them. And it's scary to say because if you can have these pretty frequently, but if you do have these symptoms that come on, please don't just assume this is another TIA and those symptoms are going to go away in 30 minutes, because if they don't go away in 30 minutes and now an hour has passed and you still got these symptoms, and if this is a full-blown stroke, you've lost precious time that we could have treated this stroke.
Wow. And so for those people who have already had one stroke, are they going to be more likely to have another stroke?
The number one risk factor for stroke is a previous stroke. Yes. Someone that's had a stroke is much more likely to have a second stroke.
Are there ways to prevent that?
Maintaining a healthy lifestyle, stop smoking, and if your doctor prescribed medications, adhere to that medication regimen. Don't stop taking your medicines just because you feel better. That's a common issue with blood pressure. People who have high blood pressure and are prescribed medications for it, blood pressure is often called the silent killer because you can have high blood pressure and you're not in any pain. You don't feel the blood pressure is high inside of you. You don't know you have high blood pressure until the doctor or someone tells you that you have high blood pressure. And the doctor can prescribe medication for you, and you take these pills every day or twice a day, and you really don't feel any effect because you didn't feel any blood pressure problems in the first place. And so a lot of people become non-compliant and they stop taking that medicine because they feel they don't need it. And a lot of blood pressure medications have different side effects. Then people don't like the side effects.
Especially men.
There are sexual side effects to some blood pressure medications, and I often tell men that when they come in and they say they don't take their blood pressure medicine, I'll ask them, I said, were you experiencing some
impotence?
And they'll admit, yes, I was. And I'll say, well, I understand that is an issue, but there are many, many, many different types of blood pressure medicines, and if you take one medicine, it may have that effect on you. If you take another one, it may not have that effect on you. So if you're taking a medication and it's having an undesirable side effect, speak to your doctor. Your doctors are very familiar with all these side effects. And if one medicine affects you one way, then they can try another medication. Sometimes one medication will work, sometimes two, sometimes three. Sometimes patients have to take a whole cocktail of blood pressure medications before they'll heal in the right combination that works for them. Everyone's different, and they've got to get the right combination of medications.
Absolutely. So before we've got to let you go, Dennis, what's the most important thing that you want to leave our listeners and viewers with in regards to stroke and being aware?
Okay. Know the symptoms. Know the symptoms so that if you have a family member or a friend and you see these symptoms in them, you'll know to call 911. You may not be able to see the symptoms in yourself if you're having a stroke, but you can call 911 for somebody else. Maintain a healthy lifestyle. Don't smoke. Eat a healthy diet. Take your medications that the doctor prescribes for you, and call 911 if you think yourself's having a stroke, or if you think someone else is having a stroke. That's the most important thing.
And don't think that it's silly, because sometimes we think, oh, I don't want to call 911, or oh, I don't want to go to the emergency room. But it could be the determining factor in saving your life or someone you care about.
We encounter that a lot. Well, I thought the symptoms would go away, or I didn't think it was that bad. And the thing about a stroke, even if a stroke doesn't kill you, it can leave you debilitated. There are many different residual effects from a stroke, from weakness, from not being able to walk like you could usually walk, not being able to speak like you could usually speak, not being able to eat, not being able to swallow, not being able to see. And a doctor once told me that, and this really made an impact on me. The doctor said, if you walk into a nursing home, you'll see a lot of patients that look too young to be in a nursing home. And you see all these patients and you think these patients aren't old enough to be in a nursing home. And he said, these are people that have had a stroke. They can no longer care for themselves. They're not in the nursing home because they grew too old to take care of themselves.
Right.
They had a stroke and can no longer take care of themselves, and that's why they require a nursing home. And that made a big impact on me. The fact that you can be young enough to take care of yourself and enjoy life,
Right.
but if you have a stroke, and even if you don't die from that stroke, you can suffer lifelong disabilities that takes a big part of the joy out of your life.
Wow. Great information. Dennis, thank you so much.
Thank you for having me.
Indeed. Dennis Flynn, he's the Sepsis and Stroke Coordinator at Christus St. Cabrini Hospital. Stay on point, everyone. We're back right after this.